Rava. Today we'll talk about the lifestyle and dietary management of raised blood pressure. I'll put links to my blog and my extended YouTube video in the description below. Raised blood pressure is a risk factor for increased risk of cardiovascular disease. Cardiovascular disease meaning disease related to blood vessels, in particular heart attacks and strokes. It's a very direct and linear correlation, and this is described here in the blog. The definition of raised blood pressure and the stages are described here. Here, there is a separate link for validated blood pressure machines. If you go for Omron, then you can't go wrong. They're all gold certified. Here we talk about how to measure your blood pressure. So you need to be relaxed. Bladder should be empty. You need to be sitting in an armchair, preferably with your arm relaxed. Keep the machine at your heart or just below that level. Measure 3 times, take the best reading. I recommend patients to take it twice a day, 12 hours apart for 5 to 6 days. Measure the average, calculate the pulse rate as well, and provide me with those home readings. Here we talk about UK guidance for target blood pressure and also the American Heart Association guidance. Here we talk about lifestyle and dietary modification to reduce blood pressure, weight loss, particularly around the waist, limiting alcohol intake, reducing sodium intake, which is salt, maintaining good amounts of or adequate amounts of potassium, calcium, and magnesium. Stop smoking if you do so. Reduce saturated trans fats. Engage in aerobic exercise at least 30 minutes a day for most days. There is a certain diet called the DASH diet, which is encouraged, which includes fresh fruits and vegetables, twice a week fish, increased whole foods and whole fiber, more protein, reduction in saturated fats. Because this often goes in with the metabolic syndrome picture, I would also recommend reduction in fructose, particularly high fructose corn syrup. Some degree of time-restricted eating or intermittent fasting is also likely to be beneficial. It's very important to be mindful of obstetric sleep apnea from a root cause analysis point of view. So patients who are obese may be snoring, may not be getting good quality sleep, and a sleep study would help in diagnosing this and potentially curing the raised blood pressure. And here at the end, the blog also describes the most common types of blood pressure medication and their common side effects and benefits.